Hi, welcome to 2.0 conference in Las Vegas, Nevada. My name is V, and I'm here with.
Hi, I'm Liz Connolly, and I'm the founder and president of the Thin Line Peer Support Team.
Can you tell us more about the business?
Sure. We are a nonprofit 501c3 mental health peer support team that services all military personnel, veterans regardless of discharge status, and first responders, inclusive of firefighters, police officers, EMS professionals, dispatchers, Department of Corrections, and all emergency department
That
staff.
is so great. We need more of those. And your company logo is no one fights alone. Is there a personal connection to that slogan?
Absolutely. No one fights alone really means that all of our military personnel, all of our first responders, when they join these fields, they wrote a blank check to their country, to their state, and so many of them are fighting these mental health battles.
Yes, I
And
agree with you.
a lot of them feel like they wrote these checks and their country, their state, their jobs, their families have just abandoned them. And in saying that no one fights alone, we want to remind them that they're not alone, that we are there for them, that their friends are there for them, that they don't have to fight these battles alone, and that there are people there that are going to be there to stand with them and help lead them back from the darkness, lead them back from their mental health battles. And one life lost to mental health battles is one life lost to many.
What do you feel that mental health care for first responder and military personnel is such an important but often overlooked topic?
I think it's overlooked because when we think about our first responders, when you think about our military, you think about firefighters, you think about police officers, the first image that comes to people's mind is a hero. We don't think about our heroes as being vulnerable.
I agree.
And when it comes to mental, and even when, our first responders and our military personnel think about themselves, we don't think of ourselves as being vulnerable. We don't want to think of ourselves as being vulnerable to anything. And there's this big stigma around mental health in the military, in firefighting, in police officers, in EMS, that if you let these jobs affect you, you're weak. You shouldn't be in this field at all. And that's just not true. There is a recent study that came out about 3 years ago that the average adult sees 2 truly traumatic events in their adult lifehood, and that's usually the death of your parents. For a first responder, and we can't even look at the military because, especially in wartime, those numbers are hugely skewed. But for first responders, the number of truly traumatic events that they will see in their adult work life is 188.
Oh, wow.
So 188 compared to 2. The human psyche, the human mind is not meant to deal with that much trauma without any sort of outlet.
That's a big number.
And when you think about a hero, when you think about mental health and first responders, when you think about mental health and the military, it's so important but overlooked because, again, these people who have gone out of their way to help their communities, to help them, to help everybody else, are drowning in alcohol, are drowning in drug addiction, are drowning in depression and anxiety, in bipolar and other mental health diseases because they don't know how to ask for help, where to find help, and in the stigma of if they do ask for help, that they shouldn't be in the fields that they love because it doesn't fit that hero mentality.
Well, I'm glad you guys are doing that because there's not that many resources, and especially for veterans, there's not that many resources for PTSD and other stuff.
Yeah, absolutely.
Thank you for doing that. Also, what advice would you give someone to follow your footsteps?
Follow your heart. When we started this team, and even still, there's, like you said, there's really not many resources out there. So pave your own way. Follow your heart. If you see the need and you believe that there needs to be something done, then be the trailblazer. Be the person to, take that machete and carve that path.
Yes.
Because if you see the need, then there's certainly somebody else who sees the need, and like minds will find their way to find, come together. You know, I started with a small team of 13 and we've now doubled in size. We have a team of 30 and we are constantly getting calls every day of, hey, you know, I know somebody who might be interested in joining. How can they join your team? So
And how do you feel about getting the award?
I'm honestly, I was floored when Health 2.0 reached out. I was honored 2 years ago with an Outstanding Leadership in Healthcare Award, and I was floored when they reached out again and said, we would love to have you come back. And I'm beyond honored that our team um, that the work that we're doing was honored again. And I was excited to come back out and able to bring this important topic, you know, to me out onto a national platform. And this award was able to
And
give us that
how's your
opportunity.
experience been here at the convention?
Amazing.
We're glad.
To be in a room with so many trailblazing and amazing healthcare professionals who have done absolutely amazing work. It's unbelievably humbling, to say the least.
Oh, well, I'm glad you're here and hope to see you again either this year at the end of the year for Dubai or Singapore or back in Vegas.
Absolutely.
Thank you.
Thank you.